So the medical interventions for male to female folks include androgen blockers, hormone replacement therapy, electrolysis to remove any hair, tracheal shave, because if you've got an Adam's apple, that just, that'll get you red right away. Facial feminization, so women who have very masculine faces may have their jaw contoured, eyebrow lift, all kinds of reconstructive kind of surgery to look more feminine. Breast implants, if the estrogen doesn't create large enough breasts for them for their what they feel like they should have. Voice feminization is now an option. It didn't used to be. You used to have to go through a lot of training to talk more nasally and higher if you were a trans woman, and now they can actually do surgery if you have the money on your vocal cords to make them thinner. And genital reconstruction, which is really involves taking the penis and inverting it and creating a vagina out of that. And those are pretty amazing. For MTAFs, the genital reconstruction is really good, and what they, even many gynecologists would have difficulty telling the difference between a trans woman and what somebody was born female based on the surgery, the techniques that they have now. For female to male folks, the main interventions are hormone replacement, testosterone. They don't need blockers, although they may need to have a hysterectomy or an oophorectomy to remove the ovaries, or to have a full hysterectomy to deal with the effects of estrogen. That they have to use a lot more testosterone before they have that, so it's nice to not have that. And then chest reconstruction, which is a double mastectomy. And there are many different ways that those things can occur. And most trans folks will know all the surgeons who do all the work and who does what and which ones they like. And you can learn a lot from them about what's the latest stuff as well, but it's good to get on the internet and look them up as well. So genital reconstruction for F to Ms, there's the phalloplasty, which they've got a radial forearm one, which takes the skin off your arm and makes a penis out of that. There's a redundant nerve and vein there that they use so that you actually get sensation. They also, in Italy, I think, are using an inner thigh that does the same thing. Metoidioplasty, which gives you a microphallus and uses all the equipment that you already have. One of the things to know about testosterone is that it grows the clitoris, so you end up with a microphallus. Some people don't want any of that stuff. They like what they have, but they want a bigger penis, like lots of men. And so they opt for what's called a clitoral release, which actually releases it from the bone. It's also the same thing that men will do when they want to have more length. They feel like they're too short.